Welcome to EAST Minute. In this presentation, we'll be discussing optimal timing of initial debridement for necrotizing soft tissue infection, a practice management guideline from the Eastern Association for the Surgery of Trauma. Necrotizing soft tissue infections are severe, rapidly progressing infections with high morbidity and mortality rates. They encompass all types of infection involving any layer of the soft tissue. Diagnosis requires a high index of suspicion. Early radical debridement is fundamental to treatment and improved survival. Unfortunately, there's no consensus regarding the optimal timing of initial debridement. Therefore, the purpose of this PMG was to provide evidence-based recommendations for the optimal timing of initial debridement of NSTI. The authors began with a systematic search of PubMed, Embase, and Cochrane library databases. These were the mesh terms used in the search. All English language articles from January 1990 through September 2015 were eligible for inclusion. The PICO question was, in adult and pediatric patients with NSTI, should early, or less than 12 hours, initial debridement versus late, greater than 12 hours, initial debridement be performed to decrease mortality? In the qualitative synthesis, 6 studies addressed the critical outcome of mortality following operative debridement for NSTI. 143 patients were managed with early debridement versus 198 patients in the late group. The overall mortality rate was 14% in the early group versus 25.8% in the late group. In the meta-analysis, a comparison of early versus late debridement with mortality as an outcome was found in 6 of the studies. Analysis of pooled data showed early debridement was associated with lower mortality than late debridement. The overall quality of evidence was very low due to the small number of retrospective studies included in the analysis. Evidence was downgraded for risk of bias, imprecision, and inconsistency in the definition of early debridement for NSTI. However, the final recommendation was, in adult patients with a diagnosis of NSTI, we recommend that patients undergo early initial debridement within 12 hours of diagnosis, with a very low quality of evidence, but a very large magnitude of effect. Despite the overall quality of evidence being low, most patients in hospitals would place a high value on avoidance of mortality and infectious complications related to delayed management of NSTI. In terms of using this guideline in clinical practice, it's important to consider formal protocols for early diagnosis, resuscitation, initiation of antibiotics, and determining the need for transfer. Transfer to tertiary care centers more accustomed to taking care of NSTI should be considered. And it's also important to remember that the long-term management of NSTI requires a complex, multidisciplinary approach.